Hello, my name is Musonda Mulundu Chipampata, and today I just wanted to talk about how most of the people and society view bipolar or most of these mental illnesses as a downer. And I just wanted to encourage everyone who's got it not to feel so left out. Because when you look at it, there's so many diseases out there like cancer, there's diabetes, there's several other diseases that people get. But basically, when you've got a mental illness, people look at you differently because of the lack of education and understanding of it. So I basically just wanted to say we shouldn't feel left out and we shouldn't feel bad about it. I recently read an article on one of the institutions based here in South Africa about mental health, where they were basically saying, discouraging anyone with mental illness to be public about it. And they were saying because of the way society is, it would look at you and make you feel bad and things like that. But if you're not going to go out there and try to educate people for them to understand what's exactly going on in your mind, how are they then going to understand? If we just keep hiding from society and not trying to figure out what we need to do, then we'll forever be isolated. The fact that we're going through something that is in form of depression, and if you're not helping other people understand what it is that you're going through so that they can give you more compassion, how then are you going to face the depression? So it's almost like mainstream society just wants to lock away the whole concept of mental illness and deal with it with medication and not exactly understand how people feel that are going through it, which is, for me, very unacceptable. Um, I was kind of disappointed because that's a group that I affiliate myself to at the moment, and I was thinking, I was going through the various articles on bipolar, and I was trying to see because they've done extensive research on it, and they've got a lot of articles. But I just stumbled upon one of them, and that was what it was, to say they've had cases where people get bipolar and then they want to go public about it and things like that, but they highly discourage it because of the way society will look at you. Basically, you know, it's not so much that we want to go public or that we want to be famous once we are bipolar. It's that we want people to understand what happens to us, so that if you happen to relapse and you happen to be around society, people that don't understand what goes on in a bipolar person's mind, it will be easier for them to then adjust to the situation. Just like any other disability, if somebody is crippled and they have to use a wheelchair, they sometimes need the assistance of people, maybe when they're getting on a bus or they're trying to get into a building that is not very wheelchair friendly. It's the same thing with us as bipolar patients. So it's just awareness, you know. For me, that's my primary goal. My primary goal is just to ensure that people out there understand what it is that we go through. Because I, for one, for the most part of my life, I had a problem of understanding my condition myself, because I was exactly like everybody else, thinking it's a form of insanity. And for the most part, if you don't understand the technicalities of it, you are going to conclude that, and that's what it's going to be based on. So I just needed to make not so long a video, but I just wanted to bring this to the attention of some people, to say we as bipolar patients have also got a voice. We're just like everybody else, especially when we're not relapsing. then we function normally. There's nothing wrong with us at the time. Like, I'm speaking very normally now. I feel very normal. I don't have any sort of symptoms whatsoever of the condition at this point as I'm making this video. So, I mean, that's pretty clear. And what saddened me was the fact that they said even the professionals uh, are not really keen on anybody exposing themselves and all that stuff to the world, and basically for people to know about it. And that for me was unacceptable, because there's people in various stages of this condition and different conditions, and they need to be embraced in society. So I'd just like to thank you very much for your time and for viewing this video. Thanks, and have a good day, or night, or evening, or whatever time you're watching it.